everybody, welcome back to theclinicaltrialsguru.com. Again, it's theclinicaltrialsguru.com. Thank you, as always, for watching. Make sure you subscribe. You don't want to miss out on stuff. I do giveaways, right? You've seen me mailing things out, gifts to people.
Yes.
So subscribe, okay? And also add me on Snapchat. You can get all the behind-the-scenes stuff. Plus, sometimes I do some Snapchat exclusive questions, which I'm actually going to do at the end of this video. So if you want the answer to that, you've got to go follow me on Snapchat. Username Dan Sfera. So today I'm joined by Monica. Monica does community outreach for one of my clinics. Actually, for several of my clinics now, right?
Yeah.
And so we're going to talk about advertising. And for those of you who might know me, you might think, well, you know, this guy's only into social media. He's not into any other kind of advertising. That is not, couldn't be further from the truth. I love all kinds of media. I just want to pay the right price for it. So Monica just finished several campaigns. We did direct mail. We did a newspaper ad. What else we got going on?
We have also radio.
Radio,
and
okay.
We are doing also pop-ups on websites.
On websites, okay. And so
on Facebook.
Okay, and we're going to get to that. So there's different areas here where sites can run into pitfalls, and I just wanted to talk about some. So after dealing with all these sponsors, you now know how important IRB approval is, right?
That's the first thing.
First thing you do?
Yes.
Okay, and why?
Because if you don't get approved prior to doing your advertisement, you can just don't get the money you invest back, and also you can be in trouble if you don't do it.
Right. Let's say an IRB finds out. I mean, first of all, as a business person, I want to know that if I have any kind of advertising budget in my contract, that I can actually get it back when I invoice them for it. And so the first thing they're going to ask you when you invoice reimbursement for an ad that you ran, whether it's online, whether it's on TV, whether it's on radio, print, or direct mail, when you invoice the sponsor to get the money back, to get reimbursed for that cost, first thing they're going to ask you is it IRB approved, right?
Yes.
We need to see a copy of that, and we need to see also a copy of an invoice from that vendor who you're using for that service. So, for example, the LA Times, right? We did an ad with the LA Times. So what's the process there? How did you go about that?
Well, before, obviously, you have to look at what's your target to choose your the source you're going to use to get them, and then most of these companies have websites where you can get all the information, prices and size. And,
now, did they have anyone at the LA Times working with you?
Oh yes, but pretty much when you call them, they will just guide you on the website.
To their website, okay.
So you just pretty much choose whatever you're.
So most things are done online now, even for traditional print. Same thing with radio ad, okay? You need to get the radio IRB approved script. If you don't have one, you need to create one and they have to approve it, right?
And also the recording is not only just the script, but you have to work with the radio station to get that recorded. So both things, you will have to send it to the IRB to be approved.
Okay, so once you get IRB approval, then you can go ahead and here's the catch. You have to pay the money. You have to spend the money up front first. And then you invoice the sponsor and they'll reimburse you. And it has to be the exact amount. So let's say your advertising budget is $5,000. Don't think that you can just invoice the sponsor $5,000 and then they're going to just send you a $5,000 check. I mean, I've seen that happen like once in my life. For the most part, they're going to ask for the invoices, and each of those invoices for an ad campaign you did are going to be a little less than $5,000. They might be like one for $1,200, then a month later another one for $1,500, then a month later one for like $1,800. So once you get to $5,000, then they're not going to reimburse you anymore. But you're not going to get that money up front. You have to show them the invoice from the vendor, IRB approvals. What else?
And also if you, for for example, you have approved $3,000 already for your budget. If you exceed that, make sure you send them like
Oh,
an
amendment,
explanation why and request the
Request it beforehand if you
Yeah.
exceed the budget, right, for the advertising.
and keep the email just in case,
Right.
because you want to have proofs of every approval.
And sometimes you do things directly, like with, in our case, with direct mail. You work directly with the post office, right?
Yes.
And so they tell you the price up front, right? And then as far as the sponsor reimbursing you, what would you do? You would just send the invoice to the sponsor?
Yes.
Okay. All right. So those are the pitfalls. Just want to make sure you guys understand. A lot of you guys are starting out your first research study and you think, oh, cool, I have $5,000 ad budget. Let me just invoice that. Or even worse, let me first spend my money and then invoice them. And then they ask where the IRB approval is. If you don't have one, at best, they're just not going to reimburse you. But worst case scenario, the IRB finds out that you're running ads without their approval and you get your study shut down. Right? You can even get FDA audited. So be very careful when doing these things. When in doubt, get the IRB approval. Right?
Yeah. Having the budget approved doesn't mean that you can completely use it without asking them. So take just the right steps before you do it.
That's right. Thank you, Monica.
Thank you.
Monica. And this is Dan and Monica from the Clinical Trials Guru. And I'm going to answer a Snapchat exclusive question. One strategy for getting these invoices expedited ASAP. But you got to follow me on Snapchat to get that, okay? Dan Sfera is the Snapchat username. All right. Thank you guys for watching. Bye-bye.